Welcome, welcome. I'm so glad you all are joining us.
Bienvenidos. Qué bueno. Sorry about that.
You've got all of us. I'm so glad we're all coming together. As you're coming into the room to show how big and powerful we all are together, can you please drop your first name and the city in the chat? We would love to welcome people and see everybody welcoming each other. So just drop in the chat your first name and your city. I'm so excited that you're here. Welcome, welcome, welcome. You'll hear me say welcome a couple times because we're just opening up the Zoom and people are just entering into the room. So I'm going to give the instructions of the name and the city in the chat a couple times. So thank you all for being here. I see Georgia, I see Maryland, I see California, Michigan, New York. Wow, it's going by so fast I can't even read them all. Pennsylvania, I see Texas. Ooh, Columbia, Maryland. That's where I went to high school. Let's give a shout out to Columbia. I see Washington State. I see North Carolina, Connecticut, Wisconsin. I see so many states, you all. We're covering the entire nation. Washington, D.C., Mississippi, Oregon, Massachusetts, Arizona. Hello, Power Rising. Look at us. New Jersey, Virginia, Delaware, Tennessee. I love this. Thank you for putting your first name and your state in the chat. Look at that power, you all. Florida, Nebraska. We've got all of the states. I think we might have gotten all of the states. I'm seeing so many states fly by. Thank you for joining us from across the entire nation. So for people who are just coming in, we're putting our first name and our state in the chat because we are amazing and powerful together, and we are showing it to one another. So thank you so much. I'm going to introduce our interpreter, Murtado, to share interpretation instructions as you're all coming on. So to you, Murtado.
Thank you, Kristen. I'm going to go ahead and provide these instructions in Spanish so that everybody knows and you can let everybody know that these meetings always have a Spanish interpretation. So thank you very much for that and for the invitation. Muy buenas noches para todas. En el chat también estoy poniendo las instrucciones en este momento, pero prácticamente para conectarse está bien fácil. Van a ver un globito o 3 puntos donde dice más, donde pueden ir, seleccionar interpretación del lenguaje español y terminado para que escuchen toda esta sección, toda esta reunión en español. En unos momentos lo van a poder hacer, pero también tengan en cuenta que les voy a poner todas las instrucciones en el chat. Muchísimas gracias. And back to you, Kristen.
Thank you so much, Murtado. Thank you to everybody who's joining us. We're putting our first name and our state in the chat. If you haven't done that yet, go ahead and do that. You can see how big, beautiful, powerful we are all together, all across the country. Due to the high volume of RSVPs, this is a webinar style. But we encourage people to use that chat function like we're doing right now, and also importantly to use the emoji function. Let's see some hearts, let's see some sparkles, let's see all of the things in the emojis. Tell us how you're feeling with emojis and in the chat. We're really excited to be here with you. If you have a question, feel free to use the question function and we will do a little bit of Q&A at the end. Before we start, I want to thank Jada, Catalina, Geronimo, the interpreters, and the Moms Rising team for all of the support, for bringing us together, for everything. And I want to thank you, yes, you, for taking time out of your busy night to be with us in action about healthcare. Today, we are so lucky. We have some spectacular, amazing, nation-lifting leaders. We have leader Stacey Abrams, who's joining us, as well as Dr. Michelle Sternthal, who's a PhD. We're going to be discussing healthcare and how we can take action together and how we can sign up. So, as an intro, it's the season for open enrollment in healthcare, particularly if you're on the Affordable Care Act, the ACA, Obamacare, all good things about healthcare. We love Obamacare. This very special, read anxious time of year, many of us are choosing health insurance plans and figuring out our premiums. Annual enrollment on healthcare.gov is happening now, and people need to enroll by December 15th for January 1st coverage. So for our conversation tonight, we are thrilled to have leader Stacey Abrams joining us, as well as Dr. Sternthal, to break down what the recent changes in healthcare mean for all of us and how we can come together to expand and also to protect affordable health care. So without further ado, I am really excited and honored to introduce leader Stacey Abrams. She is someone who has led the nation forward through unprecedented times. She is a New York Times bestselling author of both fiction and nonfiction. She's a business owner. She's a political leader whose innovative approach has continued to break through barriers and support and advance transformational progress. She's a prolific author. She's written award-winning political thrillers. Yes, I read all of them, and yes, they are amazing. And she's written children's books, romantic suspense novels, and of course, nonfiction books. Hello, can we say talented? She previously served as minority leader in Georgia House of Representatives, and she was the first Black woman to become the gubernatorial nominee for a major party in United States history. Talk about power, talk about change. We are so lucky to have her with us. She's devoted her career to democracy protection and voting rights, tackling policy issues, and building a more equitable future. She's also a serial entrepreneur and a business advisor. And in 2020, Abrams founded Sagework Productions, a media company dedicated to leveraging the power of storytelling to craft creative solutions and to engage people. I one time had the honor of watching Stacey Abrams speak in Washington State, and I have to tell you, she knew every state law in Washington State and everything about everything, even though that wasn't her state where she was from. I do not know how she knows everything, but she does. So we are so lucky to have with us the amazing, spectacular, brilliant Stacey Abrams. And I pass the mic to you. Welcome, Stacey. Let's give her lots of heart emojis. Let's give her lots of emojis. Let's put them in there. Welcome, Stacey.
Kristen, thank you so much. I'm going to make it my life's mission to just hire you to introduce me places. Let's put aside democracy and all that. It's just going to be about me hanging out with you. So thank you so much. And thank you to the Moms Rising community for inviting me in today. I'm here because we have not just a problem, we have a crisis on our hands. And this is a moment where the challenges we face are coming together. I've spent the last year and a half focusing on issues of democracy and DEI. How do we lift up communities, especially women, who are facing challenges? And as part of that, I had been thinking about this intersection of education and employment and elections and how that sustains our democracy. That led me a few months ago to the work I'm doing called 10 Steps Campaign, which is really focusing on how do we save our democracy? How do we save it from the rise of authoritarianism? How do we explain to people what we are facing? And what I keep coming back to is that as much as we hear the term authoritarianism or we hear we need to save democracy, for a lot of folks, it doesn't resonate because for some people, democracy never really worked. And authoritarianism just sounds like another way to describe why we don't get things done. And at its core, I believe that democracy has to deliver. We've got to show people why we are willing to share power, because that's all democracy is. Democracy is a community of people, a society saying that in terms of governing itself, we agree to share power. We agree to contribute our resources, contribute our time, hoping that we'll get something out of it, but knowing that if we do it, if we participate, that we guarantee more for everyone. Authoritarianism, by contrast, is a political system that says that we don't care about individuals. This is about power. It's about aggregating power to a small group of people who will not be held accountable for what they do with that power. Where democracy is about shared power, authoritarianism is about holding, harnessing, and demanding power from people without ever giving back. And unfortunately, in this moment, as Kristen pointed out, as we are talking about healthcare, this is a perfect moment to understand the difference between democracy and authoritarianism. Because democracy says that we are going to try to solve the problem that the United States has when it comes to the basics of healthcare. We can go into why things are so terrible, but we have a solution, at least a partial solution that is helping people. 24 million people right now are reliant on a program known as the ACA, the Affordable Care Act, Obamacare. And they are about to see their healthcare cost more than double. But the democracy I want to talk about was the democracy that in 2010 decided that we were going to try to solve this problem by passing the ACA, that we were going to tackle people not having access to insurance. We were going to deal with the issues of pre-existing condition. We were going to guarantee that maternal health got better. We were going to do this work together. And so we created the ACA through the democratic process. And in 2021, through the democratic process, our government said, look, we know that things are still skyrocketing in terms of cost, so we're going to provide a subsidy. We're going to give a little bit of extra money to every family, because in the midst of a pandemic, we understand that healthcare costs are rising, but you need to have help. And so we have these subsidies. And even after the pandemic subsided, we understood that we still needed a little bit of help, that healthcare costs were still rising, and that it was okay for this country to say we're going to invest a little bit more. And it was going right. And in fact, it was going so right that in order to pay for a billionaire tax cut, they decided to raid the resources for the Affordable Care Act. So that's what we're talking about. We're talking about taking money away from healthcare to give it to billionaires for a tax cut. That's why we don't have the money we need. But there is a solution. Give the money back. It's not that hard. It's not that complicated. In fact, it could be done in an instant. And the problem is there are those who do not want us to have healthcare. They do not want to solve the problem. That's where authoritarianism comes in. Instead of solving the problem, the democratic solution that we created, small d democratic, instead of using that, instead they've pushed for removing access to those subsidies to pay for billionaires, despite the hue and cry from across this country. And let's be clear, 77% of marketplace enrollees who have ACA insurance live in states won by Donald Trump. 57% of all ACA insured Americans live in Republican congressional districts, and they are demanding help. And yet, Republican leaders in Congress and President Trump have refused to help. They have refused to extend those subsidies. And so we know at the end of open enrollment, there are going to be 24 million Americans who will see their healthcare cost more than double. And millions, whether they are on the ACA or not, are going to be forced to choose between healthcare and putting food on the table. This isn't about partisanship. This is about whether we want to be a democracy or an autocracy. Do we want to serve families and our economy and our country, or do we want to serve the wealthy and the powerful? I believe that we can do the right thing, but it's going to take all of us. The 10 Steps campaign that I created, or that I helped found, the 10 Steps campaign is about here's how we got here, but here's what we need to do to get out of it. We've got 10 steps to authoritarianism and autocracy, but we also have 10 steps to freedom and power. One of the steps of authoritarianism is to break government so it doesn't work for people. And there is no more profound way to break government than to break our healthcare system. To tell 24 million Americans we will not help them. We know that half of all ACA marketplace enrollees are small business owners. They're self-employed entrepreneurs. They're farmers. They're ranchers. They're small business employees. They are moms. These are people who are doing the best they can. They are the backbone of the American economy, and they are being told, we will not help you. That is not right. But the answer isn't complex. The answer isn't hard. And I'm reminded of a sketch that I saw in the midst of the 2008 economic collapse. It was on SNL, and they brought this comedian on. It was Kenan Thompson, and he played this guy named Oscar Rogers. And when they said, what do we need to do to solve this crisis? He said, it's got just three things. Just fix it. And that's what we're going to tell our leaders. We're going to tell them to stop pretending this is hard and just fix it. Do your jobs, because the job of a democracy is to serve the people. And in this moment, we can do it if we demand it. And so what we're asking folks to do through the Just Fix It campaign is to come together with organizations like Moms Rising and Caring Across Generations, SEIU, the National Democratic Workers Association, the National Domestic Workers Association, and other labor and advocacy organizations. We are coming together and we are demanding that they just fix it. Stop pretending this is hard and do your jobs. Here's how we're going to do it. We're going to ask everyone to come together and deliver copies of their ACA renewal notices to members of Congress without any of the sensitive personal information or your healthcare information on it. Redact all of that. And if you haven't gotten your notice, you can go to the Kaiser Family Foundation calculator, and they can tell you how much your expected increase will be. And we're going to give folks instructions on how to email or hand deliver these notices to our U.S. representatives and our U.S. senators. We're going to coordinate through organizations like Moms Rising to do outreach and to do bulk delivery, because we want them to face the problem they've created, and we want them to just fix it. Because by showing them the astronomical increases to individuals and families en masse, we can highlight how these costs are a direct result of their failure to do their job. But we're not going to stop with Congress. We're going to talk to elected officials at the state and local level, to governors and insurance commissioners, to state legislatures. We're going to talk to mayors and city council members, to school board members and county commissioners. Because the reality is, if you've asked to lead us, then now is the time to lead. We want your help. We want your engagement. We want you to demand better. And that's the point of Just Fix It. Because together we can demand that this country do its job, that our leaders do their job, that we solve the problem of a healthcare crisis that they've made. And if they can break it, then the United States of America, in a democracy, we know they can just fix it. So visit Just Fix It. It's at 10stepscampaign.org. You're going to drop the link in the chat. Moms Rising has been an extraordinary partner in this, and we're just here to ask you to join us in telling Congress, telling our elected officials to do their jobs. Just fix it.
Can we get some hearts? Can we get some emojis? Can we get some giant round of applause virtually for leader Stacey Abrams? We are so thankful for your leadership, for all you do, for your words, for your organizing, for your commitment to democracy and healthcare. And you heard her. Republican leaders in Congress broke healthcare. Here's the thing. Whoever breaks it needs to fix it. It's just as easily as they broke it, they can reverse it. They can stop the cuts. They can reverse the tax breaks for private yachts, for private jets, and for wealthy billionaires. They can reverse the additional funding that they put into human rights abuses, taken away from our healthcare money. All of that can be fixed. So if you break it, you own it, you fix it. And we're saying that to Republican leaders in Congress and Donald Trump, who just broke, again, healthcare in order to give their wealthy friends tax breaks. It's ridiculous. So we saw that we'll keep putting the Just Fix It program link into the chat. We put it in a few times. We'll keep putting it in there. I hope everybody is inspired as I am by leader Stacey Abrams, by her campaign, by her effort, by the democracy that she has fought for and won time and time again. And I'll share a little story with you. We came together and helped pass the ACA in the first place, and then helped protect it more than 50 times when Republicans came after it in the past. So we know that together we're a powerful, unstoppable force. We know that our stories about healthcare are so needed, and we know everybody has a story about healthcare. Either you got sick and you had access to healthcare and you have a story there, or you got sick and you didn't have access to healthcare and you have a story there. And guess what? Democrats, Republicans, independents, libertarians, we all get sick, and everybody should have a chance to get better. So when you talk to actual constituents of members of Congress across the country, no matter what their party, they want to just fix it too. And so we're asking people to call their members of Congress, no matter what political party they belong to, and say, don't give up on us, don't give up on our healthcare, just fix it. You broke it, you can fix it. Any last words? Stacey Abrams, thank you so much.
Thank you. I'm just so excited to see all of the emojis, but more importantly, the energy behind this work. Thank you to Moms Rising. Kristen, thank you so much for letting me take some time today. And let's go, guys. Let's just fix it. Oh, I will say one thing very quickly. From folks who say we keep asking them to do things and they won't do it, let's remember, we just saw them cave on something, and we can force them again. If 24 million Americans show up, these are folks who want to get reelected, and you'll appreciate this. I always say politicians are like teenagers. They respond to money, peer pressure, and attention. Let's make sure that they can't escape us. We're focusing our attention on them, and we can get this done. Thank you so much. Y'all take care.
Thank you, thank you, thank you. Woo, let's give her some more emojis. Woo, thank you, thank you, thank you. Leader Stacey Abrams, thank you. Woo. All right, it is now my great honor to introduce our next speaker. Dr. Michelle Sternthal. She's the Director of Government Affairs at Community Catalyst. In this role, Dr. Sternthal oversees Community Catalyst's strategic engagement with Congress, the executive branch, and with national partners and coalitions focused on federal policy advocacy work. Previously, Dr. Sternthal served as Managing Director of Advocacy and Policy at the Roosevelt Institute, where she led the think tank's policy and advocacy outreach to Congress, I can't even say that today, Congress, and to allies. She also served as policy directors for the Main Street Alliance, where she leveraged the voices of small businesses to preserve the ACA, yes, the Affordable Care Act, and as the Deputy Director of Federal Affairs for the March of Dimes. Welcome, welcome, welcome. I'm so glad that you're here. Let's give her a warm welcome and lots of emojis. Woohoo, let's see some emojis. Welcome.
Thank you so much. I'm a little bit fangirling here. It is daunting to go after just an incredible leader, Stacey Abrams. And I am humbled and just in awe of the enthusiasm and excitement here. Thank you so much for that kind introduction. I'm Michelle. I'm a mom of 3, and you'll appreciate this. I'm hiding in my bedroom as my spouse puts the kids to bed. I am a cancer survivor, and I say that because we all got to be real about the way we need healthcare. And I am here to talk to you and to help motivate and give you a sense of what I've been seeing here in Washington, D.C., and hopefully to inspire you all to act. So I think that I have a PowerPoint here, and I think the tech person is gonna thank you so much and bear with me. I am gonna my goal here is really twofold, not to bore you and to give you the state of play in terms of the policy landscape so that you can use that information to the best of your ability to go and to help get us the healthcare that we deserve. And I'm going to talk about the ways in which we can walk and chew gum. And a lot of us are moms who know how to multitask. And this is going to be the way that we're going to be multitasking, both in terms of what we should be doing, in terms of making sure we get the healthcare in the real way of open enrollment. But then how do we leverage that also to go and use this moment to push and make the policymakers do what they need to be doing, which is providing us with affordable, universal care. Okay, so let's get started really quickly. Next slide, please. Okay, we all know this. Open enrollment is underway. We have the time right now when we can start going and signing up, and particularly you might do it through your employer or through the Affordable Care Act. Now's the time to choose your plan. Next slide. And there are some key dates here. You can see that it began November 1st. The deadline to get coverage, January 1st, is December 15th. The final deadline is January 15th. And coverage begins February 1st. But open enrollment this year is not the same. It's going to be way more complex. We're going to see sticker shock in terms of premiums. And there are a lot of sneaky rules in there that it's really important that both we and the people we love know about. Okay, next slide. This is how I feel whenever I'm trying to go and navigate my insurance. And I think this is the experience that we're all going to be having, I think, as we look at the current marketplace. As Leader Abrams said, premiums are rising right now for a whole bunch of reasons. The uncertainty in the marketplace, the insurance companies are going and calculating that these premium tax credits are going to expire. They're spiking premiums right now. So no matter what, whether you have employer insurance or if you have insurance through the marketplace, premiums are rising writ large. There's a lot of confusion right now. Am I going to get this coverage? Am I eligible for this? I'm not sure. There's all these changes in eligibility right now, so there's a lot of confusion. The Trump administration stripped navigator funding, those people that are unbiased and help you figure out what care you want. So that's not there. And as I said before, there's a whole bunch of new rules coming into play. Next slide. So the way I think about it right now, you can't talk about open enrollment if you don't talk about that one big ugly bill, HR 1, that passed. That was a devastating moment, and it was cruel, and it was done on the backs of people for billionaires. One of the bottom line of that is that there's estimations that over 15 million people are going to lose their health insurance because of that. And we should all be angry and pissed and not forget it. That it also means right now that lots of people aren't going to know whether they're going to get covered. And a ton of people who previously were on Medicaid, now because of new stringencies and new bureaucracies and new, fake work requirements that are actually people who have already been working, but now that it's basically more paperwork and burdensome requirements, people who before would have been Medicaid covered now are going to be looking at other options and trying to figure out if they are even if they can get coverage through the marketplace. As we said, these tax credits, the advanced premium tax credits, which were game changing, if we don't do anything, they're going to expire at the end of the year. And one thing I really want to focus on here, just because of just sort of our justice issues, there are new cruel restrictions on immigrants in terms of their ability to access care. So we're in a high stakes moment, and that's scary, but it's also an opportunity. Next slide. I want to focus in, we've mentioned these tax credits, these tax subsidies a couple of times. So here's the deal. For those of you who are not religiously following Politico, or you need to take some sort of sanity break from all of this, let me give you the bullets. These advanced premium tax credits, which help make insurance affordable and have been game changing, they're set to expire at the end of the year. So basically, if Congress does nothing, premiums jump on average of over 100%, they double. That means people are not going to be able to afford care. Right now, the premiums are increasing because insurers have priced that uncertainty into their premium plans. They have no reason to expect that it's going to be renewed. And right now, even before the EPTCs expire, people are starting to see increases. That's the state of play on the expiration. But it's not too late. Here's what's happening. There's a fight right now. In the Senate, Majority Leader Thune promised, in exchange for reopening the government after a 1 month or a little over 1 month shutdown, he promised that there would be a vote in December on the EPTC as part of the deal to reopen the government. He said, okay, we're not going to negotiate it right now, but in December, I promise. He didn't promise to vote for it, but he just promised for a vote. That's the state of play on the Senate side. The House hasn't even scheduled a vote. So they have no promise. There is a movement by House Democrats to circulate something called a discharge petition, which would basically be forcing a vote for these EPTCs on the floor. So they wouldn't be stuck. They would have to force it. And you need 218 signatures to get this vote across. So this is the moment we're in. It expires at the end of the year. It's not too late. It wouldn't even be too late after the year to retroactively do it. So there's always time for us, but we are in a critical moment. There is pressure. People are starting to feel the pressure. If you go and you start opening up your premiums, more and more people, including from red states, are going to start seeing the sticker shock. And this is a moment that we can mobilize. So what can we do? Next slide, please. Oh, right. This is just a slide to show you how bad it is. This is from the Center for Budget and Policy Priorities. I really encourage you to look at it. It goes the estimated increase by congressional district. So who your member of Congress is, you can go, you can click on it and say, you know what premiums are going to rise in your district. Okay, next slide. I mentioned immigrants, and I felt that because of just the extraordinary cruelty, I needed to spend just a couple of minutes focusing on this. As part of that big, bad, ugly bill, there are new restrictions on immigrants, and these aren't all of them. Right now, to date, up until now, immigrants who are lawfully present were able, some of them green card holders who've been in the US less than 5 years, and other immigrants who are lawfully present but are not green card holders were able to access the Affordable Care Act subsidies. Now, many are going to lose it. As of 2026, people who have green card who have been here less than 5 years, people with temporary or humanitarian status, and many mixed status families, they're going to lose access. So basically, they can buy into it, but that means buying into, if anyone's seen the COBRA plan, you know what that's like. It's unaffordable. It's awful. Really. Next slide, please. And it gets worse. Next slide. Most lawfully present immigrants, including students, workers, visa holders, TPS holders, temporary protected status holders, recent green card holders, are going to lose total access to the ACA credits. There's going to be a few groups remaining, green card holders, and there's some Cuban and other very small group of other classes, populations like Micronesians. But most families and many families are going to be left with no affordable pathways to healthcare at all. There are restrictions on many of them in Medicaid, and this is going to add to insult to injury by not allowing them to have subsidies. And this is an outrage, and it's something that we should, as we are fighting for these tax credits, we also need to be fighting to ensure that these immigrants aren't left behind. They are a part of our country. It's what makes our country great. Okay. Next slide, please. But it's not too late. And the incredible energy and mobilization here is inspiring to me. And I hope that we can harness our shared outrage to fight for our health. Here's how you can do it. The next slide, please. Okay, sorry about the formatting on this, but this is where the multitasking comes in. Here's the things that we have to do. When it comes to open enrollment, the most important thing that you all can be doing is not give up. And if you need to enroll, but first, you need to make sure your contact information is correct and up to date on healthcare.gov and with your insurer. For the first time, if it's not up to date and you don't actually go in and put it in, they're going to start charging you. More than that, do not auto renew this year. In the years past, people have said, oh, whatever I did last year, I should do this year. Why not? Do not. You need to shop for plans that meet your needs and your budget. And it may be different than what you have right now, especially because of how in flux these advanced premium tax credits. You need to cancel auto pay to avoid unexpected premium charges. And you need to cancel your plan if you don't want coverage. Because if you have some sort of tax subsidies, later on, you might not even know that you were in it. There is now additional extra rules that make it hard and make it much more, penalizing to pay back your tax liability after. So you want to be extra careful. And this is especially important for immigrants who may be on auto pay because they're trying to be responsible like all of us and just pay our bills, but now all of a sudden are going to have their subsidies taken away from them. So it's super essential you do not auto renew. Find a trusted partner or somebody in your community if you have questions about it. But then the other piece is you need to recheck. Do not give up. You definitely want to submit and put something in, but before January 15th, go back and see, because say Congress we win and they extend the EPTCs, you might find a different plan that actually works better. So update, shop, recheck. Next slide. Speak up. Now this, as part of the multitasking, this is the other piece that's essential. As you're doing this work to provide care for you and your family and your community, you also need to be documenting. As Stacey said, we want to know, we want to see pictures of your premiums. We want to know all about why these, what costs are happening. You need to be tagging your member of Congress, because right now it is abstract to them. And it's shocking to hear. I can't tell you how many times I hear from an office that says, well, it's not going to affect anybody I know, or really, no one's told me about this. So the stories and the proof is essential. And then most importantly, you need to demand. You need to tell Congress to make these enhanced ACA tax credits permanent. You need to reverse those cruel and harmful restrictions, whether they be work requirements or bans on funding for Planned Parenthood or disqualifying immigrants. And we need to go and restore the rightful health care to everybody. And those are some of the demands. And then lastly, I'll just say, at the state level, you can also think about it. There's going to be a critical stopgap measure here. States might have to pick up the slack from the federal government. So stay tuned, see what's happening in your states. If there are attempts to roll back cuts, fight against it. Push for new revenues to make up for the budget gaps. But right now, just realize it is not too late. We can act. Now, I have some resources that I think will be put in here in terms of, I have a handy infographic that has all of this information in one slide that's much more succinct and elegant than I can speak. So I will encourage you to look at those. I also know that I think Moms Rising today is launching a petition to mobilize on this energy. And Kristen can correct me if I'm wrong, but I think that's happening today. But the best thing I can say is, whatever the outlet is, share your story, act, don't give up, because collectively together, we can make enough noise that we are going to make people, cringe and uncomfortable and pushing away from their cowardice. And I really, truly believe, given this leadership, that we can, we can change things. And we're going to remember, not just this year, not just next year, but we are going to remember and not let this conversation die down. Okay. So I think with that, I will end. My apologies for going over. Oh, I didn't. Good.
Yeah, you were fantastic. You were great.
Thanks.
Let's give some rounds of applauses, some emojis. Let's give it up. That was fantastic. That was so helpful. It was so useful. We've had a lot of questions. Are we going to post this video? Yes, we will. Check out the Moms Rising YouTube page in coming days. We'll also post it on our blog. People can use this information, share this information. It's really important information. One of the biggest takeaways is the cuts to healthcare that Republican leaders and Donald Trump just did through the big bad bill can be reversed. If they broke it, they can fix it. And we also heard that our calls, our voices, our reminders, our persistence to members of Congress to let them know that we saw Republican leaders break healthcare and we need all of them to keep fighting for us and to fix it are very, very, very important right now and into the future. We are moms. We know when our kids try to hide the green beans in their napkins just so that they don't eat them. We also know when Republican leaders in Congress take away our health care and try to pretend that they didn't. We remember. So keep those calls going into your members of Congress. Join Stacey Abrams' effort. Take action. Jada's been putting the action links in the chat. Yes, we are putting out some actions. I'll read through them right now a little bit. If I can find them while I'm double tasking. The first one is an action to quick signature, lower healthcare costs, and end Trumpflation. Fix what was broken. And then we have a bonus action. If you see a high healthcare costs including your own healthcare. You can go onto the Kaiser Family Foundation website and get a healthcare cost and then take a screenshot of it. Then you can take a picture of it and post it with hashtag Trumpflation. We can do some accountability there. So we're doing some Trumpflation, hashtag Trumpflation. Second action, share your story. Your stories are so powerful. They're so important. Members of Congress sometimes don't really realize that we don't have healthcare out here, people. Congress comes with healthcare attached. That job has job-linked healthcare. Everybody in the United States does not. And you know, we need some universal healthcare. I'm going to say it. So while we're trying to fix what Republican leaders just broke, we're also pushing for expanded healthcare. So share your story about why everyone needs healthcare. We have a link for that. We also have a Protect Medicaid toolkit. That's action 3. And we want to make sure that people spread the word about the Affordable Care Act, also known as the ACA, also known as Obamacare, is opened right now through December 15th for signups. It's healthcare.gov. Make sure you go there. Make sure you share that. It's very, very, very important. You'll be able to watch this as many times as you'd like on the YouTube page. And so check that out. And I want to just let everybody know, I saw some questions about, does it make a difference when we make calls, even if the member of Congress agrees with us, or even if the member of Congress totally disagrees with us? The answer is yes. It makes a difference. Both, it helps the members of Congress who agree with us remember to keep fighting, keep championing, keep putting healthcare front and center, and it helps change the mind of the members of the Congress who don't agree with us. So keep those calls going into every member of Congress, knowing that Republican leaders are the ones who actually broke our healthcare system, and Donald Trump. And Democrats have long been fighting to save it. And I say that because that is accurate news. That's not even partisan. That's like literally what happened. So let's make sure that we remember what happened and we keep those calls going into every member of Congress. We are out of time tonight. I want to thank our speakers, leader Stacey Abrams, Michelle. I want to thank Jada, Catalina, and the Moms Rising team. I want to thank Geronimo. I want to thank our interpreters led by Murtado. I want to thank all of you for spending time with us tonight. So please give you some heart emojis, some applause. Thank you for being here. Thank you for fighting. Thank you for persisting. Thank you for not giving up on us. We do have monthly community Zoom, so you can go ahead and sign up for the next month. We'll be here because we are not giving up on me, you, or us, and we are not giving up on our healthcare. So thank you so much for being with us in community and action, and in really working to build a nation where everybody, yes, everybody can thrive. And when we say that, we really mean it. So thank you, thank you, thank you, thank you. The actions are going into the chat again if you need them. And again, check out our YouTube page. You'll be able to check this out. So thanks so much. Have a very good, wonderful, spectacular evening. We appreciate you from the bottom of our toes all the way through our whole everything. We appreciate you. So thank you so, so much. Have a great night.